Greetings. I am Dr. Yash Patel, consultant diabetes specialist, director and consultant diabetologist for Swasthya Diabetes Care and All India Institute of Diabetes and Research. Project Krishna, where we all are connected. So, who is Krishna? Who mentored Arjuna in the field of Mahabharata? And that's where, in the field of type 1 diabetes care, how you all become Saarthi as a project Krishnas. That's what these trainings are all around. It is my indeed pleasure to take the first talk of this Project Krishna training that is on first time diagnosis or first time conversations with consultants or the Krishnas. That's what vital important is. I am youngest all over world to complete clinical PhD in diabetes, and that's where it is my privilege to serve community in a better extent to support all around. So we have specifically focused Center of Excellence for Type 1 Diabetes Care, and that's where the Make My Life project is focused into for type 1 diabetes care that they became empowered for their diabetes management rather than they hide their disease conditions. So we address them, friends with type 1 diabetes. In part of Project Krishna, what is much more important is the type 1 diagnosis usually occurs in the younger age group. 6 months to young adulthood is the usual time duration where type 1 diabetes gets detected. And it is much more acute and rapidly progressing autoimmune based condition where ketosis and ketonuria as well as ketoacidosis is much more prevalent at the time of diagnosis, where glycemia is high, obesity is less frequently in the younger age group. Elderly, they yes try to get or they get weight, and the prevalence of parents to next generation of this type 1 diabetes is minimal. Usually, the ratio of type 1 diabetes to type 2 or other diabetes is 1 is to 10. That depends on the locality and epidemiology. What is much more important is when they get diagnosis, the usual stage is denial through the type 1 friends or their family member, especially mother or grandmother or their maternal mother. These are usually in the stage of denial. Then anger comes up, bargaining comes up, depression comes up, and acceptance. These are usual sequence of the stages of grief. But what happens in the type 1 journey is as they progress into their lifespan, these all stages are interlinked or overmasked. Denial to anger, anger to bargaining, depression, acceptance from childhood to adolescence, from teen to puberty, all is this is overmasked. And that's not only to the treatment, that's also to psychology, to social aspects, to educational aspects, all even the travel and habits and all are intermasked, and that's where it is much more important to make sure what condition they are facing to. Now further ahead, why it is much more important for these friends with type 1 diabetes to be communicated well. So we have specifically addressed the language in these individuals. So infants and toddlers, what their focus at the time of diagnosis or when we talk as a Saarthi to them as a first time conversation. So it's better to build the rapport to these individuals, make a friendship with them, become become the trustworthy to them, and make sure they feel that we are engaged to their life. Their life is our main priority. Their health is our second priority. And if they believe or they get trust on us, that's where we became the mentor for them. And that's where we are able to handle them. So first priority is get to know each other well. Our first priority as a Sarthi is to know the type 1 friend at the best extent as a friend, mentor, or coach, how that could be. But to become a best mentor, you need to make sure you are best friend at the first go. And when you listen to them, that's also in their best benefits. And when you speak to them, it is for also for themselves what they require your support for. So when these children are from 0 to 3 years of age, younger age group, toddler infants, At that time, the most difficult conversation is to build trust on our conversations, because they would be worried about insulins, food, monitoring, insulin devices, and all aspects. So total dependence of them is on their parents or caregiver for insulin, food, and monitoring. So we need to train their family members also, that how to communicate to others in the families, how to communicate to the children, even how to make sure they take proper care of that child for insulin, food, and the nourishment. Now coming to parent feel, also feel increase in the stress. Even they feel internally stressed, and even certain time depressed also. So that conversations also to be taken care by patiently listening to these parents. If there is an erratic eating pattern or activity in these children, because they are unpredictable, their sleeping, their food intakes, and others are haphazard. So how to be manage those aspects along with monitoring and sugar control, that is much more important. Even difficulties in distinguishing normal infant behavior from diabetes related mood swing, it is also one of the concern when there is low in sugar. All this training, hypoglycemia related, along with food, erratic behaviors, that to be taken care by their parents. So we need to empower in this age group to the parents. Make sure injection infusion set, sensor insertions, blood glucose checks, seen and pain inflict, uh, if it is there, then tend to be managed by caregiver. If hypoglycemia is difficult for the child to communicate, then how to make sure that they are in hypoglycemia, that to be taken care by parents and the children. Even longer standing hyperglycemia is much more harmful, that to be trained and communicated to parent, and that's where the monitoring is much more important. Even care in nursery, kindergarten, where their teachers also need to be counseled, and rapport building along with the trust from Saarthi to be established. Requirement of trusting attachment between infants and caregiver, support and education for parents, education about technical devices, education on prevention, recognition, risk and management of hypo as well as hyperglycemia to be taken care, and education for nursery and kindergarten staff is also involved into. In this whole process, along with Sarthi, dietitian, psychologists, and child life support are also can be added in this group. Now, moving to the further, the preschool age, 3 to 6 years of age, where education for nursery and kindergarten staff, along with family support, educating parents from the whole team, is also important. Age appropriate education for children, from their uh, schooling to sports to the education, all is important. And engagement in this are also required, along with Sarthi, our dietitians, psychologists, even the healthcare supporters and the consultants. Why it is important? Need to help they identify their hypos as well as hypers of the glucose, and learning the meaning of high and low glucose values is also important. Now coming to school age, where it is vitally credible to know for is the education for school personals or the school staff, class teacher is also important. The family support in form of hyper or in school, what happens, that to be communicated. Even advising parents on the gradual development of children independence is also important. Till time the children are bound to be with parents, but when their age progresses, they need to develop the independence of the children. Even age appropriate education for child, clarify the responsibility of for self management, pre education, as well as engagement in school activities, the sports day, the picnic day, the visitors day, the parent day, or festivals. All engagement of children are important. Even the friends birthdays to friends home celebrations, where children like to get engaged, and these were our education is important for feasting as well as fasting, as well as high on exercising or sports events. That's where our support as a Sarthi is much more important. So if you have developed well rapport with these children, this could help them to a better extent. Now, in this, what are the primary requirement to be taken care is adjusting to the change from home to kindergarten to school to children's psychology, even developing self-esteem and peer relationships with children, family members, as well as the staff of the schooling is much more important. Increasing understanding and learning to help with insulin techniques, pumps, monitoring, glucometers, CGMS, that is where to empower them. Gradual development of child's independence with progressive stepwise transfer of appropriate responsibility to these children is much more vital for their further growth after their 12s in teens, how they go in. When adapting diabetes to school program, school meals, exercising and sports is important. Not wanting to do self-management tasks in public, that is also one of the concern we need to negotiate and represent and train them. When negotiating supervision of diabetes management tasks and monitoring is important. Even progressive recognition and awareness of hypoglycemic symptoms to the children and their school members or school friends is vital. Now from 12, as individual comes to the teenage, that is also one of the vital thing because here they would be much more keen to develop their career. Even here they would develop their puberty. Even here they would have their reproductive health education. So here learning from each other and accepting each other's responsibility is much more vital. Psychologist team could be in the support for pivotal adjustment as well as planning for their career as well as life partners or the friends or the family members are much more vital. Even reproductive health education, menstrual cycle hygienes and educations, uh, personal hygiene and education is much more vital. That's where the Saarthi could be a good source of communication. Supportive technology tools in the children, how mobiles, insulin pumps, CGMS, is even the health applications are vital in their life and how they could make difference to their productivity is much more important. Even assessment of potential risk behavior using the different communication techniques, home education, in eating activities, employments, drug, tobacco, alcohol, yes, suicidal tendencies, sex and safeties. These all to be taught and talked in these children. Even engagement with different diet, physical activities, mental health specialists to these children, and readiness to prepare the transformation of themselves from pediatric to adulthood that is where required for. So in this phase, the accepting the critical role of continued parental involvement, even depleting the behavior or training them to avoid the alcohol, tobacco, and legal illegal drugs abuses. That's where we need to train them, guide them, and mentor them. Even importance of appropriate contraceptions, even pre marriage times as well as hygiene time that is much more important, promoting independent responsible self management appropriate to level of maturity and understanding, even travel hygienes, travel guides, travel um, management to be taught to them, emotional and peer group conflicts, body image issues, weight gain, risk for disorder of eatings and insulin omissions that to be taught, counseled, monitored, and look forward to. And ability to prioritize personal health. That's where much more importance to be given. Now, from adolescents, they start their family life, and in family life, before going to marriage or living, they should go through their friendships. They should be trained for their friendships and openness. They the family counselings are much more required. In-laws counselings are much more required. So and adapting the psychological, reproductive, supportive assessments is much more important. Even the marriage counselings as well as career counselings both go together. So professional counseling, traveling abroad for the professional work as well as career development, that's where the travel is much more important, and that's where they need to monitoring along with insurance technique is important. Above that, when they are married and they are planning for pregnancy, then the pregnancy counselings, pre-pregnancy counseling, glycemic control, and monitoring is much more important as they adopt the pregnancy. Then pregnancy, along with 9 months of pregnancy, handhold during delivery, and post-delivery breastfeeding. All these hygienes and counselings and their regular follow-up with medical practitioners are to be mentored and supported by Sathis. Even when they become parent, when they have a concern of next generation getting type 1. So understand the chances of getting type 1 to next generations are minimal. And in that line, make sure they are trained and empowered for their children health when though they are type 1. And as a parent, how they step up as a type 1. That to be counseled and looked for. Along with children health, they make sure their own health are at their best because children learn from themselves. That's why the type 1 friends who are stepping ahead as a parents, then they should make sure their lifestyle are their best. In this line, how Project Saarthi is much more important and Project Krishna, and you are as a Project Krishna Saarthi, how important is we have done plenty of pilots for the same. We had adopted 400 plus type 1 children along with our Krishnas, and they are testimonies to this. Different news coverage along with these consultants' references are in that background. And that's where I enroll you all around to complete this type 1 training on the first go. Type 1 handholding training with Project Krishna. First course, get certified yourself for as a Saarthi for this Project Krishna, and make sure to mentor one type 1 as a voluntary work of yourself in further line. Good luck for your career as well as being as a Saarthi. That's where it makes it this project much more special with your contribution. Thank you. If any questions, do connect to us. Put it in the questions box. There are assignments along with this. Make sure to complete it and learn at the best. Thank you. Take care.